Hello, Annalisa. Welcome to one more episode of our CRA Corner podcast. How are you today? It's Friday, so I'm so looking forward
Yes,
to the weekend.
finally. It's like it has been a week, I would say, but
Really?
definitely doing well. I think doing this and actually getting already the feedback that we are getting from the now, even though we're recording the fourth one, the first release, it has been quite good. So I don't know how you feel about that, but it's nice to see people resharing the information that this is now live and collaborating on this. I think this is really nice. Indeed,
Totally.
whoever listens to this as well, like we are not just here us two doing it together, but we are inviting guests. So definitely, if you have something interesting to tell us, or you would like to speak something interesting, then reach out to us, and we are more than happy to have you on this podcast as well.
Absolutely, absolutely. I'm having so much fun having these conversations. And I even remember so many things from the role that I forgot because after being a
Yeah.
CRA, it's been a few years, right? So you forget about those details, day-to-day details, and this serves as a channel.
Yeah, indeed, and I think as well, like for some pieces, I have felt that I'm alone. This is like the one experience, and nobody else is having this. So having to share, listening back that I'm not alone is
Yeah.
really nice, a nice thing as well.
Yeah, you're so right. It actually links very nicely with the topic that we wanted to discuss today because there's challenges, I would say, in the way that CRAs are reviewed, their performance is reviewed. And sometimes that might make you feel lonely or that you're alone in this. And I remember when I still was a CRA and I was reviewed, my performance was being reviewed based on how many days on site I was doing that month. If I was submitting all my monitoring visit reports within the 5 days of the draft, or if I
Yeah.
had it closed within the 2 weeks or 10 days, or how
Mm.
many protocols I was managing, or how many sites I was monitoring without so much taking into account maybe the burden or the tiredness or the effort that you have to put into it. That's one topic that made me feel very alone, I would say.
In addition, I think these kind of metrics are quite old school in a sense that they have been there
Mhm.
for I don't know even how many years. But if we look into the
Yeah,
monitoring plans, for example, or the budgets that are assigned to the studies, you are getting less and less on-site. It's actually metrics are on-site monitoring visits, so they're getting less and less on-site monitoring visits than maybe remote ones, or even maybe more risk-based, meaning that you get even less. So I think it's difficult
yeah,
to be a CRA trying to
yeah,
you already are actually doing your best, but you are evaluated based on metrics that no longer are your like within your scope or your possibilities because you cannot find more monitoring visits if it's not written into the budget. So it's just difficult to get this kind of
yeah,
high praise or good
yeah,
grade just because you are not able to do anything. You have acknowledged and read all of your SOPs, or you have sent out all of your confirmation follow-up letters, reports, everything you have done. What is in your possibilities and opportunities, you have done that,
in your control.
but what is not, but it's still part of the evaluation, and it's really difficult to feel appreciated in a sense if you have given your all but you are not really getting
Yeah,
the grade that you're hoping for just because you are maybe not assigned to a
yeah,
flu study or a vaccine study, which
yeah.
generates quite a lot of monitoring.
So let's speak a little bit about days on site metrics, specifically
My
these days.
favorite.
Yes. Oh, yeah, I would say it was my favorite too, but not on the favorable side, on the other side of the balance. Days on site are, or DOS, or this is the way that I
Yeah.
remember it in my performance reviews. It used to calculate a metric of how many days in a month you would go on site for a monitoring visit. So it's not specifically how many monitoring visits, because one monitoring
Yeah,
visit could be 2 days or
2
3 days.
days.
Great. Now, of course, it depends on the team that you're working for, the study you're working for, you might have 6 days on site. Great. You might have
Mhm.
9 days on site. Fine. I had at one point a average of 12 days on site every single month. Now, I would say that's a fairly sounds reasonable if you calculate how many working days you have in a month. But the trick was that you had to do more in a month because it was an average. So during the months of July, August, at least I was a
Yeah.
CRA in Spain, so sites are shut down completely.
Yeah.
December and January, most of the times, sites will not receive you or they will be on holidays, and you cannot do that amount of monitoring visits. Therefore, other months, even though your metric might say 12 days on site per month, you had to do so many more to compensate for those low
Yeah.
months. That I absolutely despised. And Annalisa, I have to say, the company I was working for that had this metric, I left the company within 7 months because of that.
Okay. It was average 12?
It was average 12. Yeah.
Wow, it's really a lot. Yeah.
Yeah, and it wasn't the company's metric, it was the sponsor's metric. And the company, we had teams that, for example, I remember Roche team. Everybody wanted to be part of the Roche team. Great monitoring metrics, they had a lot of remote monitoring, but the specific team I was in, we had this specific metric and there was no way around it. There was no way to change it. Also, there was no fit in to change within other teams. So the only option I had, because I was already not a junior CRA anymore. So when you're junior, you accept doing
Yeah.
more monitoring visits because it is what it is. But once you're a bit more experienced, you want also a more balanced lifestyle. So the only option and the road I picked was to leave.
Yeah, that's actually so you were from FSP side or you work for
I
a
was
sponsors
sponsor
directly?
dedicated. Yeah.
Okay. Yeah, because I was thinking like 12 visits and how many studies did you have? It's like
7.
7. Yeah, it's really difficult to get even like with 7 studies to 12 because it's usually you still depending of course on the studies, but you
Yeah.
still have 3 to 4 month gap between the visits, and so you even with 7 studies, if you don't have huge amount sites there, you are not able to deliver this kind of numbers. And even for us, I think I was a little bit the, the other one around because I was actually responsible for 8 to 12 studies at the same time, and approximately
Many
like
studies.
3 to 4 to 6 sites per study. So like my day, like months were full. To get to 12 was not a problem. It was like average like 12 to 16 visits per month. So if you had like 20 to 24 business days in a month, then it was a lot of visits. But I actually stumbled upon another problem because of such a high number of visits. It meant also that I was responsible the same number of monitoring reports, confirmation letters, follow-up letters, and these are part of metrics as well. And this is really like you being away 3 to 4 days a week, meaning that you basically composed the reports at the end of the day when you already had been at the site for, I don't know, 8 hours or 9 hours, and then you needed to go to the hotel and basically start again to put this together because I still wanted to be good at what and I actually to say I was good at what I did. I didn't want to like fail the metrics,
Yeah.
and that was as well a lot of like activities to do. So it's basically, if we think like even 16 visits, it means that you are sending reports 32 times because it's going to be coming back either way, and also 32 confirmation and follow-up letters, and this is just part of the monitoring. So of course all of the administrative activities that are associated with studies. So it was a difficult thing for me to ensure that I don't miss as well.
Yeah, it's very challenging, isn't it? I also remember being on a Sunday afternoon,
Yeah.
still submitting, still writing that monitoring visit report because I knew that even though I was within the time frame, with the window, let's say you have 5 days to submit that draft of the monitoring visit report, and maybe your monitoring visit was on Thursday, so I still knew I had until Wednesday because it was 5 business working days. But knowing that I had Monday, Tuesday, Wednesday monitoring visits, I wouldn't have the time to
Yeah.
write and to put my details into the monitoring visit report and then submit it. So often I spent Sundays or evenings or waking up really early morning trying to send those reports within still the day, but still before my actual monitoring visit started. Go
Yeah, I don't
ahead.
know if you actually, like in my contract, I actually had working times. So it was defined in my contract what are my working times, meaning, of course, 8 hours plus the lunch time. Fortunately, my line manager were really nice, but basically, it means that if you're doing work on a Saturday or a Sunday, it means that you're doing overtime. But I
Right.
have heard also line managers who do not approve the overtime, meaning that they basically either send it back the timesheet to be corrected, or when you go to the line, for example, they approve the timesheet with all of the overtime, but when you ask if I can get a day off because I have 8 hours of
Compensate
overtime,
that.
then they
Yeah.
will not, yeah, they will not approve this. Fortunately, my line managers were really nice and they approved my overtime, but I have heard so many cases where people, they just are putting in overtime and they do not get no money back, or they don't get any
Back or
compensated
holidays.
time off.
Yeah. I was a CRA in three different companies, right? Three main CROs in our industry. And every single one of them had different policies when it comes to the overtime when you did,
Mhm.
whether traveling, because depending in the country you live in, your traveling for monitoring visits might be less or more. And so often my monitoring visits could be within my same city, so within Barcelona, or within, let's say, a 2 hours train or 2 hours, actually just train, because Spain is so big that most of the times we don't get a car, so we don't drive. We whether go within your city or you fly most of the time. And even if you take a train, that would still be 3 hours plus. Anyways, if you put it all together and if you try to not stay overnight, if you're on site for, let's say, 6 hours, because how often are you, or 8 hours? Almost never. So if you're 6 hours on site, plus 3 hours to get to the site, plus 3 hours to return, you just naturally make continuous overtime. Some companies were very, I would say, fair about that. And we had a timesheet. We didn't have overtime tracker, but we did have, you would have to put in how many hours you stayed for the monitoring visit and how many hours you stayed for the traveling part. And that would put together the timesheet, and then you would know how many hours
Yeah.
extra you had. And then at the end of the month or during that month, if you had maybe 9, 10 hours extra, then you would say, I'm taking the day. You up
Mhm.
or round it down, something around that. But sometimes it makes you think that maybe it's not entirely fair, because every single hour I give, it's hour that I don't get to be home or to go to the gym or to
Mhm.
go have time with my family or time with my friends. So we also wanted that fairness. But at the same time, there were companies that would expect you to be able to do those activities within the 40 hours, which,
Mhm.
as you said, sometimes it's just not feasible if you have 32 reports with 32 confirmation letters, with 32 follow-ups, and the monitoring visit.
Yeah, and if you indeed do, for example, let's say you try to stay within the 8 hours. For us as well, all of the sites were in the capital, and the office is actually in Tartu, so basically 2.5 hours away. And if we try to do it within the 8 hours, meaning that I'm on the road for 5 hours, I only have 3 hours at site. And you can imagine what, like, it can bring up if you say that I'm gonna be at the site for 3 hours for a monitoring visit, which will be basically costing the same as you would be in 8 hours at the site. So for the budget purposes, nobody wants to see you there like
Exactly.
this few hours. So that would
Exactly.
definitely be even, I would say, even worse in a sense for the sponsor, because they want to see that you take this full 8 hours and actually perform the monitoring, not
Yeah.
be on the road and listening to maybe a podcast, for example.
Yeah.
But
Yeah.
basically that's like never gonna happen and approved as well. So you need to get some way the return of the overtime that you, and of course you will not go for 3 hours at site because you will not manage anything. and there is no purpose. But I think it comes down to the line manager. Of course, if you have SOP for that you must be compensated for the overtime, but yeah, I think it's down to the line manager to support on that.
You bring a good point. You mentioned you don't usually go for 3 hours to the site because then it's an expense, right? That you're going, you're traveling, you're not in the office doing something else. So it's not worth it in terms of how much you can do within 3 hours. But how many times, Annalisa, I've had to go on site specifically for one document?
On STV, which you couldn't do.
It's
It's
happened
insane.
so many times. And
Like, yeah, the cleaning itself, the database log, like, this is the worst time. Another thing that I really hate about it, for example, even not about maybe the database log, but the interim database log, is can you please select a normal time for doing not before Christmas, not before summer breaks.
yeah,
Like, why cannot we do it in like in spring and fall rather
yeah,
than the most 2 times when people are off and
mm,
not responding? And it always happens during the winter time or the basically the Christmas break
yeah,
or before the summer break. And I'm so frustrated about that. And then everybody in the study team and in the sponsor is like, how come you cannot actually get in touch with the PI, for example, or why they are not responding to queries that we have had the data for there for 3 years and nobody has checked that. Like, it's so frustrating. I was not only frustrated about that when I was a CRA, but also a clinical lead, because it doesn't work. It doesn't work really. Like, you have learned the same or made the same mistake so many times. Why are we not learning from this? I don't know. Like, it's really
yeah.
a
I want to
frustrating thing.
think, I want to think that things are changing naturally and also forced by DCTs and by remote monitoring and the remote models that we're now having and centralized monitoring and all of the tools that also technology is bringing and allows you to do so much more oversight and so much more monitoring remotely. And I'm even thinking
Mhm.
what you guys are working on with Menken Monitor at Menken Trials. We're getting so much more support now through technology that allows us not only to perform many monitoring visits remotely, more than we used to, because remote monitoring was always a thing, right? It's not just since COVID. It's been a thing for much longer than that, but now it's so much easier, and we do naturally a little bit less overall on-site monitoring visits, and we do both, a little bit of both, so we have
Yeah.
more compensate. So that issue of traveling too much, it's not such a big issue anymore. I want to speak as an industry level, not specifically for series, depending on, of course, your sponsor or your CRO or your region. You might still have that as an issue because most of the monitoring visits you do are on site, but it does indeed help. And especially for those CRAs who are worried about how can I be still a CRA and go on a maternity leave at some point? Or how can I still have kids and be a CRA? How can I still have more of a balanced lifestyle and still be a CRA? So I'm curious because you, Annalisa, you have kids. So how do you see that with the CRA role?
To be honest, when I became pregnant, I was actually already a clinical lead. And now thinking back, I have actually thought about that quite multiple times. And the way that I did my studies and being responsible for so many studies and on site visits, I would say for me, it would not be really possible anymore, just because of still the toll it takes on the kids. Even though they are small, like they're currently, okay, now they're already like 4 year olds, they understand already if mom is going
Oh,
somewhere
yeah.
or they want to have mom at home. But not being able to maybe close her computer at 5, not that I'm doing it right now with Menken trials, but basically it's still, and being away from kids, even if we go to sites, and this is not really a thing that I feel I would like. I really like the CRA role way more than I did like the clinical lead position, but just
Mm,
because of how much it actually interferes with your personal life compared to the clinical lead position, It's something that I think I would not be any more comfortable to do just because I have little kids. But I know there is a lot of people doing it, and there is definitely a way to do it. But it's just my personal like opinion and the way that I did, because I did have the amount of work that I did and the amount of work and pressure I was on. I just it's not doable anymore with kids in a way that I was able to be away from my husband for a week, but because he was just doing his own things, like, but no, or it's not just for the small kids.
Yeah.
So it's
Fair
definitely.
point. It's fair point, and it's definitely one of the options on the spectrum because there's so many CRAs who are, and therefore the spectrum is very broad. So you absolutely are right that some type of monitoring or some type of metrics or a model of monitoring is not feasible anymore once you have kids. However, I've met, and I know within the CRA Connect community, so many CRAs who have kids or have had them even some a few years ago, and there still are CRAs, and they're monitoring now. Perhaps it's a bit more balanced because they reached out to their line manager and said, "This is my situation now. Can I get assigned to some studies that you travel less, or that you have more remote monitoring, or that you have more of a lead CRA role?" But I had a colleague when I was still a CRA, and she had a 3-year-old around that, I believe. And I remember that she said, "You know what, Maria? Every time I go on a monitoring visit and I get to spend a night at a hotel, it's the best sleep I ever."
Yeah, that's true. That's so true. I even think that the most thing that will affect you is when kids become sick. That's the thing where you have all of the visits scheduled, you have everything like your
Set
calendar is
up.
ready to go, but then everything will be like mixed up. So you need to think like, where can I put the kids, or I cannot take them with me to a hospital to do the monitoring with. But definitely, like, even I myself, I have twins, and I have a colleague who is still a CRA, and she also did have twins. So she went through all of that, like the old school monitoring, and she did as well really a lot of monitoring visits. So she was as well one of the top performing, and I think she still is, CRAs, and she managed to do everything. Like she was really on top of everything, and like seeing that from side, it's possible. It's not saying that it's not
Yep.
possible, but definitely
Challenge.
it's not an easy thing to do.
For sure, for sure. So if we speak about, let's say now, how remote monitoring is changing that, what's your feeling? Do you have any experience with remote monitoring? How do you feel about it?
I think I'm one of people who I do not really understand. Like, I understand remote monitoring and the purpose behind that, but I feel remote monitoring is being done in an extremely inefficient way. It's
Mhm.
even if during like our time when the remote monitoring still became something new, or it was introduced to us, I would say remote monitoring, it didn't really have a purpose. You just called the site and you already knew that the site was not focused for you because they are
Right.
just picking your call up in middle of maybe two patients or doing something else. And it was just 15 minutes, 30 minutes maybe. And of course, we didn't have this kind of access. I don't know how much actually currently CRAs are getting remote access to the source documents because in Estonia it's not allowed by laws. And he was like really, I would say, not really an effective or really like a good tool. Definitely, it has changed. There are more now possibilities, but I think it's still, I would expect in our industry that remote monitoring doesn't actually, or even it would be more of an automated monitoring or something doing it remotely but automated way, because I feel like we should give the CRAs to be more time on sites and actually have this kind of like communication and collaboration with the sites, which I think over the time has really disappeared as well. What we used to do with the sites, sit down, have coffee, eat cake, for example, or like really, it was like a time when I could call to a PI who was maybe twice as my size and really like an authority. I could still call them, "Hi, how are you doing?" It's like being a friend and really like you had this kind
In
of
a
collaboration, but
relationship.
now, yeah, but now I feel it's 15 minutes and then they are in and out and you don't have this collaboration or partnership with them. And I think having a good collaboration is the core of successful study. Like they will be more focused on you if you have a good collaboration on with your site. So they will focus on you.
Yeah.
They will send you documents. They will complete your queries or like whatever you need. But if you don't have
Yeah.
this kind of relation, you are just one of many
Yeah.
CRAs that they see or hear from.
Yeah.
I don't know if I answered to your question, but regarding the remote monitoring, but I feel like if we see other industries and what they are doing with different tools, I think like we should be going the same way and
Mhm.
not really forcing the CRAs trying to do like even for example essential document review, for example. Okay, you have remote access, but it's still because of the restrictions of the systems you are not able to see everything because maybe the sites don't want to share, like even for example PI might not want to upload their contract in the system because they don't want the nurses, for example, to see it or sub investigators to see it.
No.
And this is really like limiting still the access to, we're doing remote monitoring but we're doing it partially or we're doing this inefficiently. It's, I think the industry, it's like really behind and we are generating different tools, but it's still not really making
We're
us
not
more
there yet.
efficient.
You're right. You are right. You bring a good point, and I definitely see in the industry the challenge you've mentioned, and I see how the industry is adjusting to that, and I am 100% sure that we are going to go towards that. You've mentioned how in different countries we have different regulation and we can have access to more of the medical records or to less, depending on your regulation. And even then, we need to make sure that it's anonymized, that it's confidential. And the challenge of electronic source records or e-source, right? Or the access to the EMR electronically is we as CRAs, when we monitor, we don't just need access to specifically the documents you give me access to. I need to see everything.
Indeed.
Because otherwise, how do I know if there's something I'm missing? If you only
Yeah.
give me access to the 5 documents I'm asking for, how about those I don't know about? That's the challenge
Yeah.
when we have remote monitoring.
Yeah, and I think that's one of the most relevant points that you make. We are just doing, like we call it, a rescue study, just trying to prepare them for inspection. And again, we are given basically a few documents and then you're trying to put the pieces together. But the reality is that because you didn't get the whole like collection of documents that are there, you don't even know if one document is saying one thing and another one is saying another thing and don't actually know if there is going to be a problem maybe just because you didn't see X, Y, and Z, and it's just not giving you a whole overview on the reality of the
Yeah.
study. Indeed, like you need to have the big picture, you need to understand everything and look into everything. So yeah, I feel like definitely it's good that we have the remote possibility, but I think what I have said quite a lot of times is that quite often the tools that are being developed by people who do not have the experience themselves, so they are of course doing their best to deliver something that could be useful,
Yeah.
but if you don't understand how the people work, then it's not going to be helping them, it's not going
Yeah.
to be making their work effective or better. So it's definitely, we are seeing some big vendors going through iterations but just because they didn't understand it correctly the first time as well. So I think it's really like relevant to understand and learn, and I really love companies who are like even smaller ones, they that sit down together. If they're, for example, focusing on sites, they actually sit down with the sites and just look what they're doing, and then they understand what is their normal day looking and what they need and what they might not need. So yeah, it's definitely.
Absolutely. And to just wrap up this episode today, here's a big cry out loud to all of the vendors that are developing tools for monitoring and for remote monitoring and tools that help more on the automated monitoring of so many administrative work that CRAs do. Please include the CRAs in your development, in your design of the tools. Just
Yeah,
involve
they
us,
are.
ask. CRAs
Yeah.
test those tools, those features with the CRA. Does this make sense? Simply ask the question from your perspective, from your experience. Would this make sense? You'll hear so much valuable
Yeah.
feedback from CRAs.
Yeah, and indeed. And what I think, because I have been CRA as well, CRAs are the, I would say, the like centrum, in a sense that they have seen the sites, how they work, they see what they are looking for, but also they are seeing how project like teams work and how they are communicating with, for example, sponsors. So like they are seeing the bigger picture rather than just, again, only their own backyard, basically. But that's
Absolutely.
extremely valuable insight and understanding what I think like everybody should be.
Yeah.
If you're developing something, they should be using it, and
Yeah.
that's what we have been doing from the start. So just including not only like clinic CRAs but also study coordinators, clinical leads, so from different backgrounds. Because at the end of the day, if you want something to be used, then you need to develop that for the end users, not maybe sponsors who log in once a
Great.
year and like export some reports. It's actually the people who you need to use them.
Yeah. But that's what we love about the CRA role as well. You mentioned that is this core, right? Between you see
Yeah.
the site, you hear from how the sites involve the patients, you hear from the study team, you hear from the sponsor of this centrum where everything goes
Mm-hmm.
through. We would say all roads lead to Rome. So it's the same thing for the
Yes.
CRA role. That's one of the things I love about it. And also that's one of the things that makes the role so relevant still in the industry and makes your career path, the development and the
Yeah.
growth of this career is absolutely endless. The opportunities, not only within cleanups, but also outside of cleanups. And maybe this is a conversation for our next episode, Annalisa. Where can you develop? How can you develop as a CRA? And what are the directions? And here you can see two absolutely different directions having come from being CRAs as well.
Hmm.
So, Annalisa, thank you so much for another lovely, amazing, super fun, and insightful conversation. And if you've listened to us, if you've watched us, if you think this is insightful, if we should be continuing doing this, give us a ping us, give us a comment, ask your questions, interact with us, engage with us. We'll be more than happy to read you and to connect with you. And see you in the next episode.